Sir, I got subscribed to Speed while I was in my second year. So I was viewing the videos regularly, and I started giving grand test after completing my examination in MT that got completed on September 15th. The mistakes that I used to do in the grand test, I used to revisit the topics so that in the next grand test it would have been solved. So actually, my 2 year senior, Dr. Abhishek, has got DM rank 6. He had taken the help of Speed. So I asked Dada, and he told me to get subscribed to Speed, and I got subscribed to Speed, and from there the journey went on.
I bring in all the wishes and greetings on behalf of all the faculty members of Speed Medical Institute to Dr. Ayan Ganguly for scoring a topmost rank of AML 25 in Pulmonary Medicine DM in Super Speciality of NEET November 2025 session. Congratulations to you, Doctor.
Thank you, sir.
Can we know your brief history from where you started till date? What are you done?
Yes, sir. So I did my MBBS from Neelatan Sarkar Medical College, Kolkata. I started in 2016 and ended in 2022. I got my MD in my running year, in my internship year, that is MD Respiratory Medicine in Medical College, Kolkata. And I just got my results 2 weeks back.
Great. Wonderful. Now, once you determined to do DM Pulmonology as a super specialty, what all you did to achieve this rank?
Sir, I got subscribed to Speed while I was in my second year. So I was viewing the videos regularly, and I started giving grand test after completing my examination in MT that got completed on September 15th. So I had around 1.5 to 2 months time. So I started giving the grand test, and also the mistakes that I used to do in the grand test, I used to revisit the topics so that in the next grand test it would have been solved.
Great, Doctor. Now, can you tell us was your preparation for how many hours per day? How you able to squeeze in your time when you're working? And about how many questions you attended in the paper and what was the paper about?
Yes. So I used to study mainly the preparation was together with the MD preparation, because I knew the MD preparation would help me in the pulmo part. The only regret I had that I didn't have much time for preparing the medicine part of the need of the INISS. I had only 1 month time. So I was preparing the pulmo part was more or less prepared from my MD period. And the medicine, I used to watch some rheumat lectures that we had in the section of the medicine part. Along with that, the neuro and the cardio. Now, I used to give grand tests also. So with that, I was getting a hunch that how many questions were coming from which sections and what to more focus at. So I used to study around 4 to 5 hours per day for that period.
Great,
And
great.
I attempted around 72 questions out of 80. And the questions were more or less this time around 50 questions were from Pulmo part, and the rest 30 questions were from medicine. In the Pulmo part, they mainly focused on the topics like the pulmonary, the embolism, pulmonary hypertension. There were a few questions about genetics and few questions about biostats as well. And medicine, more or less, there were questions from neurology. I remember there was a question about multiple sclerosis. There was few questions about genes as well. More question about gene this time.
Excellent, excellent. Doctor, interview preparation and what they asked you in the interview, can you share that?
Interview, mainly they asked about the basic concepts. Like they also asked about some few recent guidelines. Like there were some changes in the ILD. The first question was about the ATS classification of the ILD. Then they asked about studies about mepolizumab, about how to treat IPF, and what are the new drugs are about IPF. What I got that they were more interested about knowing some recent stuff this time. Uh, and that's it.
Great. Now, what is the message that you want to give for the future aspirants?
Mainly, I want to give that to study the medicine part more better, because being from a pulmonary background, we are dealing with the subject for the past 3 years. So we know that what kind of questions can come, because for the 3 years, if you study a particular subject, even it's going to be easy for you. But the only thing is the medicine part. So if you are preparing beforehand for the medicine part, it would be much more helpful for creating a good rank. And for interview part, don't need to stress about medicine. They generally ask about basic stuffs, about how to approach a particular disease and some recent aspects. If there is some recent changes, you should also study that.
Very good, doctor. And time to thank and whom all you want to thank that they helped you till date in your career.
So first of all, I'd like to thank Almighty, my late grandparents. It's their blessings that I am here, and wherever I will go from here, it's only their blessings. My father and my mother, my faculties of my college, especially Dr. Saurabh Pauja sir and Dr. Arjun Khanna sir. They both were very helpful. Whenever I used to message them, they used to reply. And sir, finally, you were very helpful in motivating us for taking one more step further. So actually, my 2 year senior, Dr. Abhishek, has got DM rank 6. He had taken the help of speed. So actually, when we were confused from where to study and all, because in college, the college preparation and this preparation is totally different. But whenever you are giving a theory exam and whenever you're giving an MCQ exam, the approach is different. So I asked Dada, and he told me to get subscribed to Speed, and I got subscribed to Speed, and from there the journey went on.
Very good, very good. Congratulations to you. Once again, we wish you all the very best and all the success for a great career in DM pulmonology. Best wishes to you.
Thank you, sir. Thank you, sir. Thank you, sir.